Associate Medical Director at Maven Clinic, Dr. Janelle Dua, joins us to talk about a recent survey regarding women's care in our current healthcare system. Doctor, thank you so very much for joining us today. GLP-1s and hormone therapy are two of the fastest growing categories in medicine right now. Your research suggests women aren't getting adequate follow-up care after starting these treatments, though. So what's going on?
Yeah, I think we're living in a time where access to these medications, GLP-1s, hormone replacement therapy, is there. But what is really lacking is that follow-up that's comprehensive and actually takes into account the woman and not just her symptoms and her lived experience. Over half of women who are on medications like these, which can truly be life-changing, say that their follow-up is inconsistent, inadequate, meaningless. So they're just getting a prescription, but not knowing how to incorporate that into their daily life in a way that actually helps them. And that's where we're trying to bridge that gap at Maven. We have our providers who are very passionate and experienced in both realms, GLP-1 and metabolic health and hormone health, that really want to listen to our patients, listen to their lived experiences. We are passionate about education and counseling, so women aren't just getting a prescription, they're getting thorough follow-up and follow-through that helps them to make meaningful, impactful choices in their lives.
I got you. Okay, Dr. Dua, a lot of viewers may be dealing with issues like weight changes, hormones, PCOS or menopause, right? So why do you feel it's often so hard for women to get clear answers and coordinated care?
Yeah, this lack of clear answers and coordinated care, I've personally experienced on both ends as a patient and as a physician. So as a patient, I myself have PCOS, now known as PMOS, and I've had to jump from doctor to doctor trying to understand if my symptoms were just a list of symptoms or if there was something overarching causing these issues that were affecting my quality of life and my health. And then on the flip side, as a physician, we know over 20% of physicians have reported that they feel true training gaps, especially when it comes to menopause care. But I believe that that can be extrapolated to women's health as a whole. So we're in a space where women are left to connect the dots. Providers don't feel trained well enough to help them connect those dots. But that's truly something we're trying to change at Maven. We have providers who love putting together the puzzle pieces, listening to a woman's entire story and helping her to navigate her health in a way that helps her improve it, and not only her health, but the health of her family as well.
Okay, so you just mentioned you personally navigated PCOS and used GLP-1 medications yourself, right? So let's expand upon that and share your experience and why you think about women's health care, right? How has that shaped how you think of women's health care? I guess it would be the better question.
Yeah, so being a woman myself that has had to navigate this healthcare system, it has really ingrained in me a passion for changing the way the traditional healthcare system works. We want women to be able to feel heard, listen to, have a good plan, an idea of what's going on in their bodies, and that's what we're really doing here at Maven.
Okay, for women watching this who may feel frustrated or unheard when it comes to their health, what would you like them to know, and what would you advise they do to advocate for themselves?
Yes, so first off, to know that symptoms, how you're feeling, they're not in your head. Women tend to know when things are off. We can be dismissed. 50% of women who navigate the healthcare system feel like they're not being listened to or heard, but we have to push and make sure we are advocating for ourselves. That means you may need a second opinion, a third opinion, ultimately trying to find providers like we have at Maven that don't just rush you in and out of an appointment, but truly take the time to listen, to ask the deeper questions, and to understand your health and you as a person so that you are provided a comprehensive, holistic plan that works for you.
Sounds pretty amazing. All right, Dr. Dua, before I let you go, where do we go to learn some more information?
Yeah, so your viewers can check out mavenclinic.com/care to see if our GLP-1 and hormone care services are right for them.
Right on. Dr. Dua, thank you so very much for your time this morning. And folks at home, if you want to watch this segment again or others like it, just head over to First Coast News Plus.